sharp debridement lab. So this is our actually our plastic bag where we have done like wound tracing. On the right top corner you have patient's name, which is a hypothetical name taken as XY Smith, and just underneath that today's date, and then you can see 6 to 12 o'clock position and a wound tracing diagram. The wound tracing diagram shows different kinds of tissue: connective tissue, muscle, necrotic tissue, and bone. If you see the book diagrams, you can see that necrotic tissue looks black in color, and there is a surrounding grayish connective tissue. And if you see a tendon or a muscle which will look like red and yellow, the tendon would look like yellow, and it's sometimes difficult to actually differentiate between the slough coming out from a wound and the tendon. So it's always important to actually remove the slough or take out the slough before start debriding. So the first part of the experiment which we'll start with is like measuring the size of the wound, and size measurements are important. So we're going to use this scale, and we're going to use the centimeter scale. You can see that's metric and it's a centimeter scale. So we're going to measure the longest length, which on a wound tracing diagram comes out to be like nearly 3.9, and the longest width nearly comes out to be 3.9 as well. And so the surface area would be 12.51 centimeter square. If we do the same measurement on our specimen, the longest width is like 3.9 here, and the longest length is 3.9 as well, which is like 12.5. So we are pretty accurate with the wound tracing and the measurement on the specimen. The first part of debridement lab, or the first part of the experiment, is like shaving the callus. So we're going to take the scalpel size of 10, and we're going to keep this aside. We take the scalpel size of 10, and we're going to wear the gloves first. The key thing here is you have to make sure that your forearm is supported, and you're keeping the blade in your third and fourth fingers, and holding it like this with the finger around the scalpel. And what you're going to do is you're going to go parallel, and pretty much what you're going to do is you're going to go parallel to the surface of the wound, and in like kind of a sawing motion you're going to start removing the wound. You can see the tissue coming off, very gentle tissue coming off. This is actually, and you can see that there is still necrotic tissue underneath, or callus tissue underneath. And in same sawing fashion, try to avoid going deep, because if you go deep you will see the white tissue, which is in viable granulation tissue, and you can pretty much give pain to the patient because of cutting some nerve endings and damaging some blood vessels. So in sawing fashion, you take off the so similarly, just go like this and try to take out the tissue, callus, and you can see this tissue pretty much is the callus tissue, and you can still see a lighter portion of the red, very clearly, lighter portion of the red, and the base orange is still not seen here, so we have not cut any of the viable tissue. I'm just going to show you one more time in a sawing fashion. Fingers around, and then see. See that you can still see the lighter tissue. Okay, so this is the first part of the experiment, and you can see the small sharp superficial flakes, and you'll debride till you reach the white tissue. And okay, so the second part of the experiment is kind of using like a cross-hacking method or cross-hatching method. And in this you'll use like a 15 number blade, which is held like in a pen position. Make sure that you don't use the sharp end of the blade, rather than use the curved edge, which is this. And what you're going to do is you're going to hold it like a pen, and you're going to make marks like in a tic-tac fashion, which is like going like this. Make sure the tip is not pointing upwards. You have to estimate the depth, that you should not go deep enough. If you go deep enough, then you'll probably be seeing the viable tissue. So that is the most important part of the experiment. We might went a little deep here, but so if you see that, and if you go, this might be a little viable tissue, and then you can see that there is a sky blue tissue here, which means that we have not gone deep enough. From the dark blue and sky blue you can see this. I'm going to cut here and show you. So just taking off the tissue here, you can see the sky blue underneath tissue, which means that we have not gone deep. I'm just going to show you what we'll see if we go deep here. If we go deep and use the sharp end of the blade, you can pretty much see the white tissue underneath, which is granulation tissue. So that is actually a difference. You do it like cross-hacking method in a tic-tac fashion to loosen the superficial tissue so that debridement can take place, and the lower purulent or sanguineous fluid can come up to the surface and can be absorbed using a dressing. So this is actually called a tic-tac method, or shaving, cross-hacking. Okay. Third part of the experiment is like using debridement, and for that we'll take like a muscle. We're going to debride the muscle. The key thing here is to actually, we're going to use the scissor as well as the forceps. Forceps will be in the non-dominant hand, and the scissors will be in the dominant hand. And so what you're going to do is you're going to keep the forceps in non-dominant position and scissors in a dominant position, and you're going to take out some snipings, and make sure that your tip of your scissor always points upwards, and you take out the sniping, and should be better supported. see that we have cut out a little bit of snipings only, and the key thing here is that your index finger should always be supporting the, and it should be pointing upwards. There's some sniping that are stuck to the scissors. I'm going to try to actually get it off. You see, I'm going to keep debriding it. You see the bluish tissue. So you can see there are a lot of snipings here, which is like kind of a necrotic tissue from the muscle, and that is it. The correct position of the scissor is important. Holding the forceps in right position is important. Cutting it parallel to the surface, and make sure that your tip of your scissor is always pointing upwards like this. So I think that's the end of the experiment, and thank you so much.